Gulf War syndrome is a condition that many Gulf War vets suffer from after returning from the Middle East, and it is a condition that overlaps with fibromyalgia and chronic fatigue. The symptoms are really indistinguishable. It's just thought that there's potentially a more underlying infectious etiology that kind of triggered or set off symptoms. The treatments are the same treatments that have worked in my patients for fibromyalgia and chronic fatigue syndrome also are effective in the Gulf War patients as well. However, there is one unique etiology that I tend to see frequently, and that is the induction of something called a clotting cascade. So in the blood, a lot of times when there are these recurrent or underlying or uncontrolled infections, if the immune system isn't handling them, many times the blood will try to seal them off or isolate them from the body, both as a mechanism that the bacteria or viruses are using to protect themselves, and so that they're not floating around in the body. Therefore, the blood flow can become less or sluggish through the blood vessels. Now, typically it's not enough to cause blood clots or scary things like strokes and heart attacks and deep vein thromboses, but it can be enough to decrease the amount of oxygen delivery to the muscles. It can be enough to decrease the flow of nutrients and even the effectiveness of medications going from the bloodstream into the cells. So a lot of times in this case, we need to use supplements or medications that will actually help to break up some of that clotting and thin out the blood and improve blood flow, nutrient delivery, oxygen delivery to the cells and tissues. And that's one area of treatment that can be a little bit different than many of the other patients with fibromyalgia and chronic fatigue.